Hello everyone, good day to you. Welcome back to my channel on kidney discovery through e-learning part 4. Let's look at the management options available when your kidneys fail. At the end of this session, you will have a basic understanding of what are the treatment options available. Let's look at the management options now. For those patients with end-stage kidney disease, they can have selective options for going to do supportive care, dialysis, or even planned transplantation. Under the dialysis, they are given an opportunity to decide between hemodialysis and peritoneal dialysis while waiting for the transplantation opportunity. Let's look at the supportive care. Dialysis and transplantation require significant lifestyle changes, and this may be difficult to manage for some people. They may perceive it as a burden. So while they receive a supportive care, they continue to get medication management, dietary advice, symptoms reduction, as well as emotional support. The next option is for dialysis care. For dialysis, the patient have an option to do a hemodialysis or peritoneal dialysis, and they can choose to do it either at home or in a dialysis unit. The patients are provided with a choice of treatment and choice of location as well. Let's look at hemodialysis now. For hemodialysis, it requires an access to the blood, uses an extracorporeal blood circuit. It's done intermittently 3 times a week, approximately 4 hours each treatment. These are some of the requirements that you need during the hemodialysis treatment, from the machine as well as all the consumables. For peritoneal dialysis, a patient also requires an access to the abdomen. A thin lining called the peritoneal membrane covers this space inside the body. The peritoneal membrane acts like a filter to the body or as a substitute kidney. Continuously and intermittently options are available if the patient chooses to do peritoneal dialysis. So how is CAPD done? It requires an access to the patient's peritoneum. It uses an extracorporeal natural membrane. Each treatment is called an exchange. Most of the exchanges are done during the day at the following time: when the patient wakes up in the morning, around their lunchtime, late afternoon, and just before they go to bed. Each of these exchanges takes approximately about 30 minutes to complete. Another option that's available for these people with end-stage kidney disease are transplantation. For transplantation option, the patient can actually have an option to either get a kidney from a live donor or a cadaveric kidney. Relatives or non-related donors also can be part of the donor. When it comes to transplantation, it has to be either planned, or the patients who have already opted to do peritoneal dialysis or hemodialysis, they are put on a transplant waiting list. For transplantation, they have to go through a surgical procedure. It requires a lifetime use of anti-rejection drugs to suppress the immune system and to prevent the rejection. So what are the factors that affect the treatment satisfaction? Well, there are plenty. We need to look at the patient's psychological states. What is their social integration? What is the social support available? Autonomous and active personality. How about the individual patient's cognitive functioning? What about the physical state? How is the decision made through the patient, the family, as well as the physicians, as well as socio-demographic conditions of the patient and the living space? These all will conclude to what kind of treatment satisfaction does the patient obtain at the end of his treatment choice. Thank you for your attention. Your friendly online guide to kidney discovery. Do not forget to like, comment, share, and subscribe this video. See you on my next episode on risk management.